Good morning, everyone, and thank you so much for joining us today for this webinar on occupational health and safety. You've probably seen quite a lot of the discussions around the protocols that have been circulating so that we can de-risk our industry and ensure the safety of our staff and guests, and hopefully convince the powers that be that we're safe to come out of lockdown a little bit earlier than the deadlines that have been put forward. This webinar is an industry-wide webinar, so we have outbound travel and inbound tourism stakeholders joining us today. So the tips and tricks that you're going to be receiving are quite broad, but they're based on the travel and tourism sector, so hopefully there'll be some good takeaways for you. You may also have seen the draft Tourism Business Council protocols that have been circulating, and I want to emphasize that these are a draft. The Tourism Business Council is actually still collating the protocols, but we are looking at the draft ones as a guideline for now so that we can be proactive and start preparing our respective businesses. So I'm not a health and safety expert, but I'm very pleased to have a health and safety experts in the room with me today. And I'm joined by Nadia Nadesan and Kenneth Boyers, who are both registered occupational hygienists from Apex Environmental. And they're going to be unpacking some of the key things for our industry to remember today. So we will be taking questions during today's session, and we'd love to get them throughout the webinar. Please click on the Q&A folder below and type your question. That will come through to me, and then I will then pose those to Nadia and Kenneth once they're done with their presentations. You can also use the chat to comment, and we'd love to see where you're connecting from. I'm connecting from a very cold and rainy Cape Town. Let me know how you're doing in the chat, where you're dialing in from or connecting from, and we'll get the discussion started. So the questions we're not able to get through today will bank, and we'll try to respond to them based on today's briefing. If you do have any additional questions once we've wrapped up, you can email those to natalia@bigambitions.co.za, natalia@bigambitions.co.za. We are also recording the webinar, and we will be transcribing it for FAQs, which will release to everyone who registered. We have about 500 people on today's webinar, so thank you so much for logging in and joining us this morning. And thank you to Kenneth and Nadia for joining us and sharing some of their expertise. So on that note, I'm going to introduce you to both Nadia and Kenneth. Thank you for joining us. Kenneth, I'm going to hand over to you. You can share your screen and we can get kick-started.
Okay, thanks, Natalia. Morning, everybody. So I'm Kenneth, and a little bit later on, you're going to see or hear from my colleague Nadia. We're really excited that we can share some of our experience and expertise with you guys today, and hopefully just give you some practical insights into COVID-19 and what all of you can do in your own industries and businesses to help protect yourselves, your staff, and all of your guests and clients. So I'm just going to start sharing my screen. Okay. And I hope, it may just take a few seconds. My computer is pretty slow, or the one that I'm using.
Coming through, it's coming through. It is a Friday morning, Kenneth, so we have to be patient.
It's a crispy 24 degrees in Durban today. So naturally, I'm wrapped up in a blanket and a scarf, and I even have these cotton hand gloves on. Okay, so I hope you can all see now. Okay, so basically the title of today's webinar is Occupational Health and Safety for Tourism and Travel Business at a time of COVID-19 and beyond. So I'll just jump right into it.
Sorry, Kenneth, before you jump on, can I ask you to maybe just switch your video off, because we're having a little bit of issues, and I think it might be your bandwidth. So just if you switch your video off, maybe the sound will be a little bit better. And let's see if we can get going.
Is that better?
Perfect. Off you go.
Great. Okay, thank you. Okay, so I thought we just begin by giving a brief introduction to who Apex is. The reason being, you never know if or when you might need us. So if you know what we do, how we can help, or if you need our services, at least you know where to get us and what we do. So we basically are SANIS accredited and the Department of Labor accredited or approved inspection authority. So basically all of those regulations, or a lot of the regulations in the Occupational Health and Safety Act, for instance, the hazardous biological agents, the chemical regulations, asbestos, noise, we do basically monitoring and inspections for all of those kinds of hazards in the workplace. So we basically assist and guide clients with the legal obligations in terms of the Occupational Health and Safety Act. And we also focus very much on protecting the health of your employees and also the public in general. So we specialize in occupational hygiene and environmental monitoring. We do risk assessments, training, and we also sell a whole bunch of equipment. Okay, here my computer's being a bit slow again. Sorry. It has actually frozen now.
Not to worry, Kenneth. I wonder if maybe we shouldn't ask Nadia to hop on and do the protocol first, and then we can switch back to you. How does that sound? Nadia, would you be available to do that for us?
I think actually, Mark, it seems okay now. If you're happy for me to continue, Natalia.
Let's give it a shot.
Okay, sure.
Sound is a bit funny, but let's give it a shot.
Okay, I'll try to talk a bit louder. Can you hear me now?
Sounds great.
Okay. Yeah, so basically in terms of occupational hygiene, so we do things like hazardous biological agents, risk assessments and monitoring. We can do audits of your facilities such as canteens, kitchens, change rooms. We do indoor air quality assessments. So for instance, if you have, say, a mold problem or funny odors, heat and humidity problems, anything that basically affects your air quality inside, we come in and test, investigate what the problem is. We can do economics assessments, asbestos. Yeah, and also a whole bunch of environmental stuff. So we can measure if you're having problems with dust or noisy neighbors, water sampling issues, we can do all of that for you. And we also sell a whole bunch of equipment. So it's light meters, indoor air quality meters, alcohol breathalyzers, weather stations. You never know if you may need one of those. Okay, so I'll just jump right into what we're here for today then. And that's basically, what kind of knowledge can we instill, sort of share with you guys? So our presentation is broken up into two parts. Nadia later on is going to be taking you through the protocols, the tourism protocols. But before we do that, what we wanted to do is basically just instill in everybody the basic fundamental or underlying principles, the tools and the knowledge that you're going to need to be equipped with when you start up your businesses again, to make sure that, that you are protecting yourselves adequately from COVID-19. So I just wanted to start off then by sort of looking at lessons learned from history. This is just 2 slides, and I think there's some valuable lessons here. So in about 1975, there was an inquiry into the states of occupational health. And what they found was that managers weren't conscious of occupational health. They weren't committed to promoting occupational health in the workplace, and they paid little attention or heed to inspectors when they came around. The occupational health practitioners themselves were undertrained, and they had insufficient knowledge of occupational health. The workers themselves were also ignorant of the health effects, and the controls that were in place were completely inadequate. And so basically those 4 factors are really a recipe for disaster. And so I think as a starting point, make sure that you guys tick each of these boxes. So make sure that the managers are very much committed to protecting yourselves and staff and businesses against COVID-19. Make sure that the people you've appointed to manage that aspect have been well trained and have the right knowledge. Make sure that your workers have been well trained, and make sure that the controls you implement are sufficient and adequate. Yeah, and so as I've said, the best thing we can do for you guys today is to basically teach you how to do our job. And I'm just going to go through that a little bit this morning. And it's sort of like a 5-step program, if you will. So as I said, we are occupational hygienists. And so basically occupational hygiene, what that means is we identify hazardous agents in the workplace. And it's very broad. There's just some examples here, but it's extremely broad. They could include chemicals or physical stresses such as even, say, heavy lifting, musculoskeletal, stresses, noise, but importantly for our topic today, it includes hazardous biological agents. And we look specifically at those hazards that can cause disease or discomfort. We evaluate the extent of the risk posed by those hazards. And then probably most importantly, is we look and recommend on how to control those hazards. Okay, so this is your 5-step program, and I'll go through each of these in a bit more detail. So step 1 is identifying what the hazard is, and in our case today, it's obviously COVID-19. Step 2 is looking at the severity. What is the harmfulness? What is the consequence of being infected? And we'll go through that a bit more in detail. Step 3 is looking at the probability of being infected. And I think this, so step 1 and 2, when I go through them a bit later, it's just general information for your own knowledge, I suppose. But steps 3, 4, and 5 is really where you guys are going to have to step up your own game, make sure that you're well equipped with the right knowledge so that you can implement. Basically, so step 3, assess probability of being infected. So you're going to have to do risk assessments in your own work areas, your own staff, determine the risk. Step 4 is determining the overall risk rating. So looking at the consequence and the probability, and I'll explain that a little bit more later. And then step 5 is how do you control that risk? Okay, so I'll jump right into it. So hopefully we all know by now why we're all stuck at home, and that's because of COVID-19, which is basically just an acronym meaning Coronavirus Disease 2019, which is a respiratory illness. I think most of us also know by now that COVID-19 is caused by the virus SARS-CoV-2, and that stands for Severe Acute Respiratory Syndrome Coronavirus 2. And you can see some pretty cool little pictures down here of the virus. We'll talk a little bit more about its structure a little bit later, just for interest's sake. So coronaviruses are not new to humans or to our knowledge, and it's certainly not the first time they've affected us. They're a very wide group of viruses, and they cause illnesses which range from mild to quite severe. So where does it get its name? Corona, well, that's the Latin word for crown. And you can see here, it's got these little crowns or spikes. And I suppose bored, lonely scientists try and find excitement in their life, and perhaps, I sound judgmental now. But they gave it a pretty cool name, coronavirus, because of the little crowns it's covered in. So some of the coronaviruses that have affected us in the past have included MERS, which originated in 2012 in Saudi Arabia, SARS, as we knew it originally, so originating in China in 2002. I think most of us also know or have heard that coronaviruses are zoonotic. That means that they have basically originate in animals and they've hopped across to humans. So for instance, SARS in 2002 originated in bats, then jumped across to raccoons and then finally to humans. MERS, perhaps no surprise coming from Saudi Arabia, jumped from bats to camels and then to humans. And COVID-19, they've been, I think at this stage still speculation, but nothing confirmed. Okay, so how then is this virus transmitted? I think this is the first crucial step in making sure that you're well equipped to deal with preventing, or basically to protect yourself and everybody from being exposed or infected with the virus. So I'll go into this a bit more detail. This is just a little introduction with a nice picture. So basically the primary mode of transmission is through droplets coming from an infected person, for instance, from sneezing, talking, and coughing, if you're within a 1 meter radius of that person. And secondary mode is through what we call fomite. So that is a surface that's become infected with those droplets. And I'll talk a little bit more about that soon. And then the third possible but not proven or not concrete route is airborne transmission. So aerosols are what we'd call airborne droplet nuclei, tiny little microscopic particles. And I'll talk a little bit more about that as well. This is just another picture illustrating the same concept. So you can see here these two people standing within a 1 meter radius of each other are at a high risk of being infected or transmitting the disease to each other through droplets. The secondary or less risky form or route of transmission is through through fomites or contaminated surfaces. And then thirdly, and possibly, is through aerosols. Okay, so just going back then to the first or the primary route, droplet transmission. Yeah, so that's basically generated during coughing, sneezing, talking, or certain medical procedures such as suctioning. And what's very important to note is that once, once a person's coughed or sneezed, if it lands, say, on your arm or on the nape of your neck, it's not going to magically be absorbed into your body and infect you. There are still really only 3 ways it's going to get into your body, and that's through your conjunctiva or the inside of your eyelids, through your nasal mucosa, basically inside of your nostrils, or through your mouth. So those droplets don't remain suspended in the air, and they don't travel more than 1 meter. This is just a nice little table to illustrate the point or illustrate the kinds of droplets that might be generated during different activities and how many droplets. So for instance, normal breathing over a 5-minute period, you might see a few droplets. Moral of the story, don't stand next to anybody even when they're breathing or politely ask the person not to breathe. No, don't. Okay, yeah, so then if you go down to the bottom, if you see coughing, you could generate up to a few hundred or a few thousand drops, sneezing a few 100,000 to a few million drops. I've been sneezed on by somebody before as I walked past them, and they got me right in my neck as I walked past them, and I was completely soaked in whatever came out of them. Luckily, it was well before COVID-19. Okay, so the second route of transmission is indirect contact, or as I said, fomites. So that's basically contact with an object that has previously been contaminated with the SARS-CoV-2 virus from an infected person. And importantly, again, so let's say somebody coughs onto a desk or onto a handrail, computer mouse, something like that. You still have to, that virus still has to get into your body through the same sort of routes in your body. So again, that's your eyelids, your nasal mucosa, or your mouth. And I hope you appreciate my little pictures here. So you can see a guy touching his eyes, somebody picking their nose, somebody sticking their finger in their mouth. Okay, and then the third possible route is airborne transmission, what we refer to as droplet nuclei. And they really are microscopic. So it's less than 5 microns in diameter. So I think that's like a thousandth of a meter. They can remain suspended in the air for significant periods of time and can certainly travel over distances of greater than 1 meter. So what does the World Health Organization say about the possibility of airborne transmission? So yes, there has been some preliminary scientific evidence that it is present. It can be transmitted through air, but there's nothing concrete yet. So they're saying that you need to interpret those reports with caution, and certainly in high-risk areas. So, for instance, in hospitals, in isolation rooms, medical procedures on infected people, then you need to take airborne precautions, but generally not in normal settings. So, in the normal office work environment or hotel room or what have you. Okay, and I also just threw these in here. So people have also asked the question, well, can it be transmitted through food? The World Health Organization says no, that's highly unlikely, but still treats food and food packaging as a potential source of surface contamination. So a food packaging can still be contaminated with the virus, and you go and touch the packaging, touch your eyes, touch your nose, and there you are, you're infected. They have found the virus in feces. So the World Health Organization says, yes, there is a risk that's been identified. They're saying that it's quite low, but still take precautions. And you'll see in the protocols later, there have been, they've recommended certain PPE for bathrooms. There was a webinar last Friday where the hygienist said, definitely do close your toilet lid when flushing. Okay, so how do we begin to assess the risk of COVID-19 and the virus that causes it? So in the hazardous biological regulations and sort of generally internationally, we categorize biological agents into 4 groups, 1 being the least hazardous, 4 being the most. So group 1 would be, for instance, like a chef cutting mushrooms in a kitchen. So mushrooms are a fungus. If they're still in good condition, they're not going to cause any human disease. Group 2 would be something like E. coli that you might be exposed to when scrubbing a toilet. It could cause illness. It's unlikely to spread to the community, and there is treatment available. Group 3 would be, for instance, something like finding a used condom in bed sheets when changing someone's bedding. So that could cause severe human disease, say like HIV or hepatitis B. There's a risk of spreading to the community, and for these agents, there normally is treatment or prophylaxis available. So group 4, I'll read all the lines because it's relevant to us. So it says there, causes severe human disease. It's a serious hazard to the exposed person. There's a high risk of spreading to the community, and there's no treatment or prophylaxis available. So you can kind of see that based on what we know about COVID-19, COVID-19 certainly would fall into that category. Although in terms of the regulations, it hasn't specifically been named or categorized as a group 4. As practitioners, that's what we categorize it as. So how is it going to affect you if you become infected? So I think all of us know by now that the majority of the population won't be seriously affected, will at worst experience mild to moderate symptoms and recover without requiring any special treatment. But for people with comorbidities or vulnerabilities or pre-existing medical conditions, their risk is higher. So who are some of those people? Well, that'll be people over 60 years of age, severely obese people, people with serious heart conditions, chronic lung disease, including moderate to severe asthma, people with post-TB scarring, poorly controlled diabetes, poorly controlled high blood pressure, people on dialysis or with severe liver disease, people undergoing cancer treatments, HIV positive people who aren't currently on treatment, people currently infected with HIV or currently suffering with cancer. And in fact, the list is a lot longer than this. I've just put in a few highlights here. Okay, and I think we've all been well schooled on the main initial presenting symptoms. So that's things like fever, cough, sore throat, shortness of breath, fatigue, aches and pains, headaches, and also some gastrointestinal issues, diarrhea and what have you in some people. Okay, so basically they've sort of described COVID-19 as falling into 3 or 4 different categories, ranging from mild to moderate to severe. In moderate, you're going to have moderate pneumonia, going up to severe pneumonia, escalating further up to acute respiratory distress syndrome, which is basically a serious lung condition, not enough oxygen getting into the body, scarring of the lung tissue and what have you. And then finally, sepsis, which is a life-threatening organ dysfunction caused by the infection. Okay, just some little images again, just to illustrate the point nicely. So initially, the virus might affect your upper respiratory system, so your nasal cavity, back of throat, voice box. It can then progress down into your lower respiratory system, so your lower airways, and the alveoli, which is basically the little air sacs at the bottom of your lungs, the functional parts of your lungs where gas exchange occurs, where you absorb oxygen and breathe out carbon dioxide and what have you. This is just a little picture showing what happens inside your lungs, inside those alveoli or those air sacs when you have moderate illness. So if I hope you can see my mouse moving around here. So basically, yeah, so here is the little air sac where the air would come into. And you can see here around is a blood capillary, or a very thin, very tiny little blood vessel. These are the little blood cells inside. So in your normal healthy lung, you'd have a, a very easy and quick exchange of gases being passed through from the space in here into the and attaching to the red blood cells, and vice versa. What happens when you become infected with COVID-19 is it basically launches an inflammatory response inside your lungs. So it causes inflammation. So you get a whole bunch of different white blood cells, a whole bunch of chemical signals uh, uh, being sort of directed towards this area. You start to get inflammation in this tissue around the alveolus. What happens when you get inflammation is that this distance between the blood vessel and the alveolus gets greater, so the gas has further to travel, which makes it a lot more difficult for you to get the oxygen you need, and also to get rid of all the waste that you breathe out. You also start to get fluid buildup inside this alveolus. So you can imagine it's sort of like drowning, I suppose you could call it, because you are literally filling up with fluid inside of your lungs. There's something inside of your lung, in the alveoli, called surfactants. It's basically a chemical that prevents the two opposite side walls of this alveolus from sticking together. This virus causes that surfactant to stop being produced, and so there's more. I suppose it's sort of like becomes sticky inside. So these walls stick together. It's more difficult for your lungs to expand, for those little air sacs to expand. I'll move on to the next picture. I hope I'm not scaring anyone too much. So when we get to the severe stage, you can see, look at all of this gunk now stuck inside that air sac that was once just a nice big round bubble filled with air. You can appreciate now how not much air is going to be able to get in there. There's now a lot more inflammation and also scarring. So look at the distance now that the gas has to travel. Yeah, and so that's why you hear them talking about people gasping for air, feeling like they can't breathe, pain and what have you. So, so potentially, yes, this can have very severe health effects or impacts on a person. And that's why it's so important for you to identify your vulnerable people at work and also in your own home, and make sure that you take extra precautions to protect them. And we'll talk about that a little bit later on. Okay, so we've looked at how the disease might affect you sort of physically, but when we're looking at the severity of the disease, we also need to look at what is the risk posed to the community, what are the chances it's going to spread in the community. And you may have come across this term called R0, and it's basically a disease's reproduction number, or the average number of people that can be infected by one contagious person. So generally, an R0 value of less than 1 means that one infected person will infect less than one other person. So logically, that disease would die out pretty quickly. If the R0 value is greater than 1, it means that one infected person will infect more than one other person. And so that disease is going to spread quickly in the community, and there's a risk of possible outbreaks or epidemics. So yeah, so this disease is really new, and I'm sure you've heard scientists have been working really hard. Then articles aren't even being peer reviewed or approved before they're published to the world. So there've been various R0 values put out there for this virus. Initially, they were saying it was around about 2. So you can see here on the top line, so some people are saying initially say about 2.2 to 2.7, 1.4 to 3.8. I read an article yesterday that was flagged as early release. In fact, it's only due to be released in July. And their data suggests an R0 value of 5.7, which means one person could affect up to 6, or just rounding off up to 6 people. So this is not to scare you, but you can appreciate how infectious, how contagious this virus potentially is. Of course, July, somewhere away, this value could be disproven. We'll just have to wait and see. This is just a nice little image to show you that same concept. This is based on an R0 value of 2. So here you can see your original infectious person. That person will infect 2 people. Each of those 2 people will infect another 2 people, and so on and so forth, until you end up with all of these people being infected over here, just from this one person. You can imagine how much bigger this picture would be if it was an R0 value of 5 or 6. Okay, so onto the third step then is looking at the probability of being exposed. What are your chances actually of becoming infected? So here we look generally at 2 things. So we look at the characteristics of the virus and also the characteristics of your work environment, because those both play a factor. So one of the theories or principles that have been put forth is looking at the amount of virus that you're exposed to, or what they call the infectious dose. And it suggests that the higher the dose of virus, or the higher the concentration, I suppose, of the virus you are exposed to, the more severe your disease will be, possibly. So the thinking goes that if you're exposed to, say just a mildly contaminated surface, say like a handrail or a door handle, if there are just a few little viruses on there and they get into your body somehow, your body is able to cope with that, and your immune system will get rid of it. If that infectious dose is very high, it's going to overwhelm your immune system, and you're not going to be able to deal with it. And you're more likely to develop the disease and more likely to develop severe disease. And you can appreciate even at this stage then how important washing your hands is, sanitizing your hands, sanitizing surfaces, because if you're reducing the viral load on those surfaces, you're being exposed to less of the virus. Then the second thing we look at is the job characteristics. Here we look at the frequency and the degree of human contact. So if you take, for example, say a high traffic reception area where a receptionist is exposed to lots of people all day long, versus say an admin clerk who works in their own office where nobody visits them, for a lonely admin clerk, but luckily they'd be safer. Then we'd also look at the nature of the task. So for instance, handling soiled laundry versus say a gardener working out far out in the garden, not being exposed to anybody or anything contaminated. We also look at the nature of the workplace. So for instance, say a shuttle car where you are in a very small confined space, very close to other people with not very great ventilation, compared to say an outdoor pool area where people are spaced further apart, there's good natural ventilation. Step 4 then is to determine the risk associated with infection. So this is basically the risk matrix that we use at Apex. And risk, the overall risk, we basically determine by looking at I hope you can all follow my little cursor, the severity versus the probability. So I said earlier that COVID-19, or the virus that causes it, we regard it or treat it as a group 4, HBA. If this was the full matrix, you would see here all the other groups as well. So you'd see group 3, group 2, group 1. But because we're dealing specifically with COVID-19, we've just put in this group 4. So we assume that the severity is constant, and I'll talk a little bit more about that in a second. What can change is the probability of being exposed. So let's say we're talking about that person, let's say we're talking about somebody working in the laundry of a hospital or clinic that's specifically dealing with COVID-19 patients. If they're going to be handling and washing that person's bed sheets, well, they're probably going to be up here. So their probability is going to be frequent contact, potentially at very high levels. And because it's a group 4 HBA, we can see that it's going to be a very high risk. If we compare that, say, to the gardener, who maybe works alone, has his own little tool shed and equipment shed, doesn't really go inside the hotel or the B&B, Well, his exposure probability is quite low, so it would be infrequent contact at low levels, and he'd be, say, a low to medium risk. So just a little bit, an extra note on that, on the severity aspect of it. So there's two ways to assess the severity. So what we do as a consulting company is we assume a general workplace risk of 4, basing it on the fact that it's a group 4 HBA. The second way you can do it is to assess each person individually. So for instance, let's say your gardener is a 20-year-old athlete who's working part-time as a gardener. Well, he's pretty fit and healthy, and his or her risk might be quite low compared to, say, your laundry worker who is asthmatic and is 65 and a smoker and obese. So there, the severity, the potential severity of their diseases would be a bit different. Regardless of which approach you take, you have a legal duty as employers to absolutely determine the risk or identify and evaluate the risk of all of your vulnerable people. So you really do still have to identify who all of your vulnerable people are and take added precautions, however may be necessary. Okay, so step 5, mitigating the risk. So I think most of us know this guy over here, Sheldon Cooper from the Big Bang Theory. This is basically how my own colleagues view me. This is me every flu season. I don't let anybody come near me. Please don't touch me. Don't come too close to my desk when you're sick, etc., etc. So yeah, and I'll talk a little bit more about that just now. So when it comes to mitigating risk, there's basically 2 ways that you can approach it, and they're both very important. The first way is a proactive way, or preventative controls to help prevent being infected in the first place. And the second way is reactive, is basically to reduce the impact after there has been transmission or infection. So how then do we actually mitigate the risk? Well, in occupational hygiene, and perhaps even in your own backgrounds, you may have seen something similar. This is what we call the hierarchy of controls, and its order is, it goes in the order of effectiveness as well as importance. So right at the top is elimination. It's the most important and the most effective, followed by substitution, engineering, administrative, and PPE. In the case of this virus, so yeah, basically the top 2 layers, elimination and substitution, aren't really all that applicable when it comes to a virus in terms of public health. We would use those principles more sort of, let's say you're working with a hazardous chemical and there's an option to use a less hazardous chemical, or not use it at all. So you could eliminate the use of that chemical entirely and eliminate the risk completely. Or perhaps you could just substitute the chemical. Let's say you substituted from one that can cause cancer to one that might just cause mild skin irritation. I think we can all agree we'd rather go for skin irritation over cancer. What really now starts to become relevant and applicable and very important to us in COVID-19 are the bottom 3 layers. So those are your engineering controls, your administrative controls, and your PPE. And I'll go through each of those in a bit more detail. I'm just going to check the time very quickly. Okay. So yeah, so I'll begin then with engineering controls. So first up is ventilation, which is an engineering control. So you need to make sure that you have adequate ventilation in your work area, and that work area is everything everywhere where you might work. So that's your car, the kitchen, the hotel, or your establishment in general. So that ventilation can be either by mechanical means or by natural means, such as opening doors and windows. Here it says effective LEV system with HEPA filters. This is more for healthcare settings. So LEV stands for localized exhaust ventilation. That's, for instance, handling samples inside a biosafety cabinet. HEPA filters are still relevant and applicable to you guys because you can install those possibly in your current ventilation systems. And we'll talk a bit more. I think Nadia will discuss that a bit more later on. Certainly, you need to still undergo or undertake regular maintenance of those air conditioning systems. And still also, so the people who are going to be working on those ventilation systems are themselves potentially going to be exposed to the virus. So they also will need trained and with the right PPE if they're going to be changing filters and cleaning and what have you. There's also recommendations for, if possible, disabling air recirculation on your ventilation system. So preventing any airborne aerosols or droplet nuclei from being circulated in a room. The second engineering control is isolation. So that's basically your physical barriers, and you can see I've got a little picture here. I see in industry or in the market, these are being marketed as sneeze guards, which I think is gross, but anyway. And then thirdly, biometric systems. What they're saying, what the Department of Employment and Labor are saying, is that if you do have biometric systems, you need to either disable those or render them COVID-19 proof. That would basically mean making sure that you, let's say it works by fingerprint scanning, you need to disinfect that scanner before and after every person. So I was at a company the other day who had recently upgraded their staff clocking in system from a card system to biometric at a cost of, say, hundreds of thousands. And they said to go back from biometric back to the card system would have cost an additional few $100,000. So they just couldn't do it. And so they are now still using this biometric system. I refused when I went in. I said, no, thank you. You can just open the gate for me. And in fact, when I was inside, I saw people walking. So even though the company had put in hand wash stations and signage and sanitizers at these clock-in stations, I still personally watched people walking right past, not washing their hands, not sanitizing. So I'm very glad that I refused. So the next level of controls are your administrative controls. I'll say this, your engineering controls are probably the most expensive initially in terms of initial cost outlay, but they'll be the most effective, and in the long run, although there may be maintenance costs and what have you, yeah, they require less effort and less maintenance, less admin, I'll put it that way. Admin controls very much puts the onus on you and your employees. It requires some action by you. So that's things like social distancing, keeping a distance of 1.5 meters, working from home, rotating your shifts, staggering break times, etc. Sanitizing and disinfecting your surfaces. So the directive from the Department of Employment and Labor is saying, yeah, so 70% alcohol hand sanitizers. You need to provide sanitizers to basically at all entrances inside the work area. If your employees are working off site, you have to provide it to them as well, excluding people working at home, and also provide it for use by the public. You need to disinfect your work surfaces regularly during the day as well as at the start and end of the shift. I'll try to speed it up a little. I don't want to take up too much of everyone's time and Nadia's time. I think this is quite important here. So how long does the virus last on surfaces? So I think this top layer here, I think you should actually just disregard. So it says here aerosols could remain in air up to 3 hours. This, as far as I know, was based on experimental data. So in an artificial lab environment, it's not necessarily indicative of real world conditions. We can just assume there's a possibility for aerosols to be present in the air in certain circumstances. So on copper surfaces, it can last up to 4 hours, cardboard up to 24 hours, plastic 2 to 3 days, and stainless steel 2 to 3 days. So again, you can appreciate how important it is for you to be sanitizing your surfaces regularly. Okay, more admin controls, so washing hands, information and training, really, really important as a starting point. And your symptom screening and medical surveillance, Nadia will talk more about. And then PPE controls, I think we're wrapping up, so it's getting towards the end, sorry. Okay, so PPE controls, you'll see your directive specifies at least 3. cloth masks per person. The Department of Employment and Labour Directive says at least 2. I think what's important to emphasize here is that the cloth masks that are being prescribed for the public and for everybody at work it's not PPE, so to speak. It's basically like a personal isolation device. You're protecting other people from you. And if we're all protecting everybody around us from us, effectively we are doing the same thing. We're all protecting ourselves and each other, if that makes sense. Yeah, so mandatory to wear cloth masks while at work and while commuting to and from work. If you have employees who are going to be exposed to the public, they need to be wearing visors as well, or if not, then those sneeze guards or physical barriers. In addition to that, your high-risk employees, so either because they're vulnerable or they work in high-risk areas, they're going to need additional PPE, and Nadia will specify that. But it could include things like N95 masks, appropriate gloves, appropriate aprons, face and eye protection. Lastly, your reactive controls. So after an incident, that's going to be procedures and action plans for things like what to do after you have a suspected or confirmed case, how to decontaminate the workplace after you've had an incident, how to quarantine a person who is infected or may be infected, and what do you need to do for a person who's returning to work after being infected. Okay, I'll skip through this just to save some time. It's basically just a little summary. Maybe I'll go through it quickly. Okay, so step 1, we know we're dealing with COVID-19. We know that it can be transmitted primarily through droplets within 1 meter. Secondly, through contaminated surfaces. And thirdly, and possibly through aerosols. We know that it causes severe human disease. It's got a high risk of spreading to the community, and there's no treatment available as yet. Your risk of being infected depends on the viral load or the infectious dose, how often you're being exposed to it, what the nature of the task is, and what the nature of your workplace is. Step 4, I've skipped out, but it's basically just giving a risk rating based on probability and severity. And step 5 is risk mitigation. That's through your engineering controls, your admin controls, and your PPE. So I just have some parting thoughts here for you. So basically I posed the question to you, when is a good time to do a risk assessment? And you see I've got like this little flow diagram here, all parts of your day. So from the time you wake up in the morning, when you're commuting to work, at work, eating, shopping, going home, you need to basically be conducting this risk assessment in your head at all times, because at all times of day, you are potentially exposed to that virus. And you can see in the middle, I've put the picture of that classic tale of the Trojan horse. I'm sure you're all familiar with the story. So basically, soldiers sort of all snuck inside a Trojan horse, gave it to their enemies. The enemy is, I forget, some kind of gift or what have you. They took it inside, closed the gates, and snuck out in the middle of the night and killed everyone. So if we compare that to the virus, you now know the only way that the virus is going to get into your body, it's going to be through your eyelids, your nose, or your mouth, or inhaling in certain conditions. So as long as you are aware of that and you know how to mitigate that risk, there should be no reason why that virus should gain entry into your body. Just one final thing here, just to illustrate the point. So if you imagine these are 2 colleagues at work, I don't know why you should have to pass a baton at work, but okay. So let's assume that this guy here is infected. Maybe he's coughed and sneezed on his hand and then touched this baton. So, and he could also cough and talk and transmit droplets onto this guy here. Let's assume they're within a 1 meter radius. So this guy is pretty much at risk here. He could be infected through fomites by touching this baton. He could be infected directly by droplets and possibly also through aerosols. So how would we protect these 2 guys? And so don't judge me for this next picture. So here we go. This is basically what our world is going to look like for the foreseeable future. So here in the margin, you can see things like your administrative controls, including medical screening and medical checkups and monitoring by medical professionals for your vulnerable people, things like washing and sanitizing hands. Here you can see this guy's been given a physical barrier to protect himself from, or rather to protect both ways, both parties. He's wearing his mask. The baton's been sanitized regularly throughout the day, as well as start and end of the day. Here you've got your queue controls to prevent or to ensure social distancing. This guy's got his visor on and his mask, and there's a nice little open window to ensure good ventilation. So yeah, I'm basically going to be saying goodbye soon. So I think my parting thoughts to you are basically just to be calm, be sensible, be equipped with the right kind of knowledge. I'm reminded of those WhatsApp messages that everybody was sending around about my cousins, nephews, aunties, uncle who worked, who's giving all sorts of weird advice about COVID-19. Be diligent about your control measures, be respectful of everyone around you, and that includes wearing your mask. And I guess now I'll hand over to Nadia, and I apologize profusely that took so long. But thank you, everybody. Thank you.
Thank you, Kenneth. I'm glad your audio held out for as long as it did. So Nadia is actually going to take the background that Kenneth has given and apply a tourism and travel lens over that. Nadia, floor is yours.
Hi all. I'm just going to be switching off my video just to save some bandwidth as well. All right, so let's begin. I'm going to share my screen with you now as well. Kenneth, can you stop sharing your screen? Oh, cool. Thanks, Kenneth.
I'm now also acutely conscious of everything I touch, what I'm breathing. It's a very scary place. Thank you, Kenneth. You've really made me think about it. Very interesting, but very heavy. Whew.
And Natalia, can you see my screen?
I can.
Okay, perfect. We'll begin then. Okay, so this is the part 2, and well done, Kenneth, on that presentation. Thank you. So with regards to the part 2 of this presentation, we specifically going to focus on the protocols that have been set. All right, so it's the overview of the protocols. It's aligned with WHO, that's the World Health Organization, as well as the National Institute for Communicable Diseases, NICD, the Department of Employment and Labor, and the guidelines and advice. So currently, if you know, the current threats posed by the epidemics, such as Ebola and cholera, pandemics like influenza and SARS-CoV-2, have become increasingly evident as an ongoing universal challenges, universal challenges to public health, right? So effective prevention and control protocols are the cornerstone for combating infections. And as such, the tourism industry has developed comprehensive protocols for the operation of all types of tourism business or facilities in times of the COVID-19 pandemic. Okay, so some of your protocols, they include customer information, your PPE, your physical distancing, which is social distancing, sanitization, and hygiene practices. All right, just note that these are going to be revised because as soon as new information is presented by the CDC or the World Health Organization. All right, so you guys are all aware of your protocols. You've got your first one, which is the pledge of adherence to protocols. Okay, it's signed. All CEOs, general managers, and or owners have to sign this pledge. Designated COVID-19 health and safety officer and team leaders. Okay, you've got all businesses, you've got health and safety officers, specifically COVID-19 officers, owners and managers for small businesses particularly, medium businesses, you can employ a manager on it, dedicated officer, large businesses, team leader, medium and large businesses. All right, so COVID-19, you must note, like Kenneth explains, spread is emotionally challenging for many people, changing day-to-day life in unprecedented ways. And all sections of society, including employers and employees, should play a role to protect themselves and each other and help prevent further spread of the disease. Okay, so these responsibilities set up by your designated team leaders and officers, they have to conduct risk assessments, and they have to develop, implement, and manage controls as per your hierarchy of controls. All right, Kenneth has given you that nice descriptive diagram indicating your hierarchy of controls from the point of elimination all the way down to your PPE. I will show you a different one as it's applied to COVID-19. If you look at my screen here, sorry, I think it's slightly blurry, but I'll go through it with you. Obviously, the elimination for now, we cannot remove the hazard, which is COVID-19. All right. We go to substitution. We cannot replace the hazard either. No, so substitute or changes to the work process by social distancing and remote working is essential, right? In terms of isolating the hazard, okay, how do we isolate it? What measures do we adopt in terms of engineering controls? Things such as thermal scanning, okay, that when you guys enter the workplaces, we take your temperature, we see whether you guys are within the limits. Maintaining social distancing by markings and barricades. Admin controls, signs, posters, awareness programs, the protocols issued to you by your tourism industry, right? Those are all admin controls that are employed. PPE, mandatory use of gloves and face masks, okay? Strict monitoring on the use of PPE. Okay, so with regards to your GVPC, all right, I know those are your guests, your visitors, etc. Right, you've got required of all GPVCs, okay, on arrival, checking, boarding, entering, pickup industry will be developed, industry will develop a standard form. You can utilize loyalty cards or apps and QR codes, okay. Contents of the declaration from specified in the protocol, which you guys all have, and the form will include a risk rating. Okay, GVPCs and staff temperature monitoring. All GVPCs on arrival, boarding, pickup, check-in, etc. Multiple stays at breakfast, departing hotels each day. You retake your temperature for all experiences greater than 2 hours. Your rental drop-offs, leaving the facility, disembarking, okay? All staff members, including management, visiting outsourced staff on arrival for shift or on departing after the shift. Okay, so this is where you need to take action if temperatures exceeding 37.5 degrees. All right, so this is quite interesting with regards to your signage. Signage and easy to follow guest information, extensive info for guests, okay? Posted in areas where you guys are generally like sort of, congregating around, rooms, your backs of the vehicle seats, reception desk, notices by lifts, etc. Okay, first arrival check-in or boarding, standard briefings, all GVPCs, similar to airline safety briefings, and the content specified on protocols is specific to your admin controls. Staff training. This is very important, all right? And this form of training can be either through toolbox talks, all right? And one of the training, as we're doing now, is a webinar training, right? So staff training, extensive training for all staff, virus characteristics, sanitation and disinfection, right? PPE, uniform changes, administrative controls, and additional job-specific training for high-risk staff. Okay, so we've got it bolded here in terms of C regulation for your hazardous biological agents regulations, all right? In terms of information and training, right, your employer is required to, before any employee is exposed or may be exposed to an HBA, and after consultation with the Health and Safety Committee, established for that section of the workplace, ensure that the employee, that is you, is adequately and comprehensively informed and trained on both practical aspects as well as theoretical knowledge. Okay, so you need to understand your Occupational Health and Safety Act as well, where it has sections for your HBA. You need to understand the contents and the scope. You need to understand the risks caused by the exposure, the measures that are taken by your employer to protect the employee, the importance of good housekeeping, okay, that's very vital, and this is important for you guys. The importance and precautions taken by employees to protect him or herself. Remember, it's not only the duties of the employer, it's also the duties of the employee. What are you required to do to protect yourself and protect your coworker? The necessity, the correct use and maintenance and potential of safety equipment, all right? The necessity of medical surveillance, okay? The safe working procedures, and the potential detrimental effect of exposure on the human reproductive process. All right, so that's all listed in your HPA regulations. Guest visitor passenger clients PPE. All right, so Kenneth touched on this as well. The mask, your cloth, surgical or N95s are mandatory, excluding your guest room. Okay, when you're in there, your small group in self-drive hire car, eating or drinking. All facilities and businesses must stock, provide spare masks, okay, and changeable at discretions. If specialized masks and laundry services offered, they must provide small sealable bags, used masks, and new sterile bags, which are clean masks. Biohazard containers for disposable of masks as well. Remember, you also have to contain your PPE. You don't know what virus or what was if you are actually you could be an asymptomatic person, all right? So in terms of disposing of your mask, you need to also take appropriate measures. You must also understand that the spread of COVID-19 is mainly via respiratory droplets. When an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. Therefore, wearing a fabric face mask is added as a prevention measure to help limit community transmission of the virus. Staff PPE. I know I put a little funny there with regards to cutting a hole in your mask and eating. That is not allowed, okay? So masks are mandatory at all times, excluding during eating. Type and quantity, disposable, a sufficient number per staff and per member and per shift. Cloth masks, minimum of 3 times per staff member. So I know somebody had asked a question on the group. Please, this is your answer. A minimum of 3 per staff member. On shift and transfer home, in the laundry at home provided by business, and clean and ready to wear in the next working day. All right, so this is just added information for you guys. So what's very important is to follow the recommended guidelines and basic rules of usage of masks, right? Face masks should never be touched when wearing them, okay? Fidgeting with the mask repeatedly is strongly discouraged, and it is important to avoid touching your face with your hands. All right, I often do that because I often like touching my nose. I like touching, rubbing my eyes. Those are habits that we actually need to stop now, because this is where you stop the virus. When I sort of do a risk assessment, and I do this every day, as soon as I get up from my bed, I say, what is the risk of me taking my next step? So that's how you guys need to be thinking. What is the risk of me stepping into this new task? Do not lower the face mask when spreading or coughing or sneezing. All right, remember, the mask is meant to contain. It's meant to protect me when you're wearing it, and when I'm wearing it, it's meant to protect you. Okay, the inner side of the face mask should not be touched with your hands. All right, remember, if you don't sanitize your hands adequately, whatever's on your hands is going to be transmitted into your mask. Face mask should cover your nose and mouth entirely, and wash fabric face masks with soap and water and iron when dry. Okay, so I've gotten pictures in terms of additional job-specific PPE. This is a nice little table that's drawn up. You've got your disposable gloves, you've got clearing, wash up, waste disposal, disposable shoe coverings, laundry staff, disposable plastic aprons, room cleaning, cleaning and wash up, disposable gowns, washable boiler suits, laundries, waste disposal, and vehicle cleaning. Visors, any close proximity to guests, all right, and perspex shields, which are often used by your receptionists, other counter workers or cashiers around the drivers in vehicles. Right, you guys will have this presentation, so you can go through that again. Sanitizing and hygiene practices. Remember, it's critical defense against COVID-19. All right, frequent GVPC and staff hand sanitizing, washing, and frequent proper sanitizing of surfaces. All right, continuous use workstations, sanitize your own workstation, and every 10 to 15 minutes, continually do that. Remember, you need to adopt a habit of doing these things. Okay, so once you do that, it'll be second nature to you. Non-continuous use workstation surface sanitizing schedule as well. And note that the World Health Organization does not recommend disinfection tunnels or room fogging. All right, ineffective, and it's chemical health risk. Remember, often we tend to ignore. People are now saying, you know, it will help kill the virus, but if you dose with excessive amounts of chemicals as human, right, this could result in other respiratory issues and ailments for you. Okay, remember, disinfectants are often asthmagens, right? So they will have effects on you. So it's important to know, since COVID-19 rests on surfaces, cleaning and decontamination of surfaces at homes and workplaces remain essential. The coronavirus can live for hours to days on surfaces like countertops and doorknobs. How long it survives depends on the material and the surface is made from. So hand sanitizing, all right? In terms of GVPC, sanitize your hands on an initial arrival. Consider shoe sanitizing upon arrival. Your pens, your credit cards, phones, wallets, purses when used as well. My rule of law is, what I do is I reserve one bank card for when I go shopping, right? So I know that bank card would be a high risk because it's being passed from me to the cashier. So try to adopt measures like that. Use like sort of almost common sense things, right? Changes in situation, example, boarding or disembarking, widely available throughout establishment, all right? For staff, before and immediately after entering work premises or the vehicle, after changing into uniforms, after using lockers, frequently while on shift as well, and particularly after touching items on surfaces. Just note, all these are common sense. I mean, how would the virus transfer from any surface or area to you? That's what you should be thinking, okay? And appropriate non-touch bins for disposal of your wipes as well. Surfaces. Wipe and clean with appropriate disinfectant detergent. In terms of frequency of doing this, after every use or after every change of person or people using, or frequently minimum requirement, okay? So see areas specified in the protocol as well. Your protocol has listed numerous areas of disinfecting surfaces, right? Limit touching of surfaces by GPVCs by, if feasible and safe, deploy porters, security, other staff to open doors, press lift buttons, etc., leaving doors open or slightly wedged, all right? Surfaces, on a side note, on disinfectants must be applied for at least the minimum specified contact time and minimum prescribed concentration. See, for example, Clause 33 of the Department of Health COVID-19 Environmental Health Guideline, all right? And also you look at the US EPA disinfectant use against your SARS-CoV-2 virus as well. I know there was a question as well on the chat box. What disinfectants do I use? This could answer your question. Alcohol minimum of 70%, ethanol and isopropanol. Chlorine via sodium hypochlorite, they say about 0.5% of it, right? Quaternary ammonium compounds, peroxides can be used, and phenols can be used. Just remember, all these are actually chemicals, all right? So you must apply precautions when using these. Your luggage, all right? So spray and wipe with disinfectant after offloading, at least all handles and corners, all right? Staff handling luggage. Sanitize and wash hands immediately before and after touching your luggage. Right. In the protocol states that if guest handles own luggage, disinfection is not required. However, use your own discretion here, because you don't want the guest to actually transmit the virus from your luggage onto other surfaces. So if the guest had contacted another person, or shook the other person's hand, or had the virus and now is touching other places, maybe it's a good thing to actually disinfect, ask them to disinfect their hands or their luggage as well. Cash handling. I don't actually use any cash now. It's mostly used with my card. Minimize or eliminate, example, prepayments, EFTs, credit or debit cards. You've got those functions on your banking apps. SnapScan, Zapper, signing to accounts. If the guest staff handles cash, sanitize hands immediately after. Remove surfaces, okay? Reduce the number of surfaces to be touched. Disinfect it in establishment and also in vehicles, and see examples in your protocols. Example, your games, your magazines, your decor, etc. Also note that the coronavirus viability is reported to be lost at higher temperatures and higher relative humidity. So example, temperatures of 38 degrees and relative humidity of greater than 95%. Okay. The SARS coronavirus at low temperatures and low humidity environments may facilitate its transmission in community. So the transmission of the virus is dependent on various factors. All right. Okay. Reduce use areas, lock areas in use, which can be taken out of use to eliminate usage, for regular surface cleaning, deep cleaning in event of contamination. Look at examples in your protocols. They specify spas, gyms, executive lounges. Limited use on request could be possible as well. Right, in terms of general, biospill kits, cleaning of blood and vomit, all right? Only appropriate disinfectant surface cleaners. Only 70% alcohol and hand sanitizers should be used. Swimming pools, maximum safe level of chlorine, other antimicrobial agents as well. Regular servicing and proper function of your HVAC systems, which are air conditioners, water reticulation systems as well, fridges, dishwashers, and laundry equipment. Where possible, install HEPA air conditioning filters, okay? They note to filter out about 99.999% of particulates. So they're very good in terms of recirculating anything back into the environment and holding it in. Laundry, hot cycle of greater than 70 degrees plus usual detergents. Dishwashers, washing about 150 degrees to 160 degrees. Rinse cycle about 180 degrees. Standard physical distancing and capacity controls. We know this. Minimum of 1.5 meters social distancing. That's about 2 meters preferred, right? Exceptions, visors, perspex screens, GVPCs from same small family or friend group, GVPCs who share a room or a car, right? Maximize on online reservations, e-check-in and e-check-out. Other types of non-contact processing. I actually just order online if I needed something like, food or anything of that sort. I try to order online. Remember, when you receive these items, you also must apply disinfection protocols. So even though you're ordering online, you must make sure you wipe it down before taking it into your homes or your businesses. Capacity controls, restaurants and bars. Remove excess chairs, stools, tables should be removed. Enlarge and combine tables, reduce the spread of seating. Heed any regulations, example, maximum 50 people, including staff. Guideline of 50% of prior capacity. Queuing, any or all of potential queuing points, all right? Demarcated 1.5 meter spacing, example, floor markings, bollards, or ropes. Must be monitored and adjusted if inadequate. Lounges and waiting areas. You space out, remove, tape off excess furniture, remove multiple seaters, or clearly demarcate and display seating capacity. Capacity controls. Casinos, for example, remove chairs, tape off machines to ensure 1.5 meter spacing. Demarcations as above, about 50% capacity. Reduce surfaces as above as well. And sanitize machines after each and every user. Lifts. about 30% capacity clear signage, remove carpeted floors if possible, staff supervision of queues at main lift entrances if possible at all, and if possible, staff should man main lift entrances, example, off lobbies. Pools and pool areas, reduce the number of lounges to about 2 meter spacing. Pool use capacity determined and monitored by lifeguards. No intergroup play or mingling, all right? And pools with high play usage should be closed. Dormitory rooms shared by non-group or family, 50% capacity should apply here. 4 to 5 meter square minimum spacing per bed, and only one bunk bed per bunk bed unit. Minibuses, buses, and coaches. Guideline about 70% capacity, empty seat spacing, await further international generator market standards, and perspex shields for drivers if possible. Cars which are chauffeured, no passengers in the front passenger seat. I mean, we apply that in our vehicles. Small cars, one person in the rear only. Larger luxury cars like your minibus, your bigger SUVs, 2 people in the back. Demarcate central seats at not for use, and perspex shields for drivers if possible. Cars, self-drive, same small family, friend or group, about 2 to 4 people. Parties not known to each other, no sharing. Food service. Okay, so revise the menus to reduce complexity. I think it was somebody that had asked questions about what happens with buffets. Okay, so you discontinue if you can do that, if possible. Limited self-service, select pick-up pre-portioned items, handled by staff only, and perspex screens if possible. Self-service beverages manned by staff. Recommended services, pre-portioned plus plated buffets on delivered to tables. Deli type takeaway, grab and go meals. All right, disposable containers, crockery, cups, cutlery. Remember, we try to limit the use of sharing cutlery. Okay, small rubbish bags for waste and disposables. Menus, electronic, fixed board, disposable or sanitize after each guest. Waiting staff, greater than 1 meter from the table with floor markings. Greater than 1.5 meter is recommended as per the regulations. Okay. Seat guests as on far side of the table from waiter if possible. But you must also take into note contact in terms of surfaces, and Kenneth touched on these aspects of format transferal. Declutter tables, essential items only. Sealed packages, sauces, tea, sugar, butter, etc. I know in my office space, we often have a communal area where we actually obtain our tea and coffee, and they're generally in jars, and we share a spoon to dish it out, place it into our cups. Those things you need to minimize and actually get rid of. Okay, distribute exact portions, disinfect unused portions. No guests who self-serve from packaged containers. Food service continued, clearing and cleaning. You need to implement a system as per your protocol. Designated containers for different items and cleared. Sealable refuse containers for food waste. Different staff for where size and volume permits, clearing and servicing. Minimize items on waiting stations. Substitute room service with deli or takeaway and disposables. Trays, boxes, and containers procedure. You place it outside the room on the floor. Alert the guests by knock and ring. Delivery staff stand back about 2 meters until the food is accepted. Guest instruction. Leave the waste in bags provided outside the room. Remember, you're applying measures of that the virus is respirable, okay? You can get it via contact or aerosols. And also, you can also get it via contact from touching things. So this is what you should apply your risk assessments around. So kitchens. 2 keys to safe kitchen operation, all right? Physical spacing, including possible staff reductions, surface and equipment sanitizing. Simplify your menus to reduce production complexities, number of the staff required, range of supplies required, and external interactions. Demarcate physical spacing at workstations, and facing workstation, you try to eliminate if that's possible, okay? Because remember, if somebody's not wearing their face masks appropriately and somebody coughs in front of you, that's where your contact is going to occur. Perspex screens, okay? Sanitize all equipment frequently. See examples in your protocol, it's listed. And food packaging in containers after each use. Separate high temperature washing of kitchen equipment and guest crockery and cutlery. Maximize your ventilation. Remember, open your windows, allow for natural dilution, okay? Or efficient air conditioning. Fumigators or ozonators can use to deep clean kitchens and storage areas from time to time. Remember, apply caution with all these aspects. Hotel rooms and vehicles. Reduce the frequency of room cleaning. Long stay every about 2 to 3 days. Linen changes, long stay for about 3 to 4 days you would be applying. Intensified cleaning and disinfection. Remember, eliminate turn down service. Remove non-essential items. We've spoken about this. Okay, you can see these things are repetitive because they multiply in different areas. Convert to electronic in-room hotel guides ideal. Remove and reduce minibar stock. Hand sanitizer must be placed in all rooms. Also, new room cleaning standards required. Train the staff on the new standards. Okay, will include linen handling as well and bathroom sanitizing. Remove cleaning staff, sanitize hands and shoes and aprons. Room cleaning staff, you must have sanitized your hands before, shoes and aprons. On finishing each room and before entering the next room. Surface sanitizing, see the surfaces specified in the protocol. There's a list of them there. And if possible, rotate your rooms. Leave idle for 1 to 2 or 3 days and decontaminate after that. Ensure that there's sufficient room ventilation as well. Soil linen, like Kenneth explained. All right. Remove from beds with care and fold it simply. Minimize shaking and dust release. Remember, you're trying to not allow the virus from spreading more. Place into ample quality bags. All right. Housekeeping trolleys. Reduce the contents. Trolley and contents wipe clean at the end of each and every day shift. Remember, people are going to be using these trolleys as well after every shift. All other cleaning equipment, dip it in sanitizing solution after each room is cleaned. Color code your cloths for different surfaces. Clean it, use sink, toilets, and room surfaces at a different color. Disinfect separately as well. End of shifts, sanitize in solution about 30 minutes. Wash your clothes on a high heat cycle. Vehicles. Reduce the surfaces, remove all non-essential items, example magazines. Water bottles, remember, it's unique per guest. Surface sanitizing, frequent use, shorter vehicles between each use. Longer trips, end of day, deeper cleaning. Higher vehicles, similar deep clean and on return. Deep cleans, you may use a fumigator or ozonator with caution, okay? You must be trained when you do these. Remove and clean all mats, disinfect all surfaces, okay? Refer to your protocols. Spare wheel compartment, oil dipstick, petrol caps, for example. Cleaner PPE, okay? Your gloves are mandatory for cleaners, okay? As well as disposable aprons, gowns, boiler suits are optional. Staff areas. Okay, so update staff contact info on medical history, all right? Remember, your medical history has to be updated, because if you're immunocompromised, you stand at a greater risk of contacting the virus. So just note that you have to protect yourself. If you suffer with high blood pressure, you have to let your employer know, right? Risk rank worker areas as high, medium, and low. Special consideration for vulnerable staff, okay? If you're over 60, you need to apply measures, all right? There's different comorbidities as listed by the Department of Health, okay? Assign to low risk areas, smaller shifts, enhanced work procedures, additional PPE, example, face visors, okay? Consider providing staff accommodation, All right. Avoid public transport. Separate and stagger shifts and teams. Avoid cross-infection. Stagger locker and change room times and create smaller groups. Regular surface disinfection, including biometric scanners. Okay. Sanitize on arrival, hands, shoes, phones, and handbags. Remember, caution must be applied. Temperature screening on arrival and departure. Reduce the complexity of uniforms, okay? And uniform change laundry procedure, ideally in-house or outsourced. Follow the same GVPC procedures and standards for staff canteens, kitchens, and bathrooms. Service elevators, staff transport vehicles, and outsourced workers must ensure that the records are kept by outsourced companies as well. Adhere to all SOPs that you've provided. ID vulnerable persons as well, and keep same staff on the same shift. Office staff. Work from home policy if possible. Stagger your shifts, okay? Reduce teams of shifts and reduce occupancy. Remove space apart, tape off of desks and chairs about 1.5 meter distance. Perspex screens to separate facing nearby workstations, all right? Remove superfluous desk items. Regular hand sanitizing. Regular sanitization of surfaces as per section 9.2. No touch refuse bins, okay? Do not do that. No sharing of desk equipment, headsets, PCs, telephones, etc. No hot desking, all right? Remember, these hot desking involve multiple workers using a single physical workstation. So try to eliminate that. All operations via telephone, online, no walk-ins. Maximize ventilation or windows or your AC. Reference to the WHO guidelines for offices, and you can see this within your link in your protocols. Procedure for symptomatic staff and GVPCs. See procedure, there's a really nice flow diagram that's provided in your protocol. Adhere to that. Designated isolation rooms, single occupancy, no shared bathrooms, reduced touchable surfaces, served by dedicated low-risk staff. Additional staff PPE must be visors, eye protection, disposable gloves, disposable gowns, and consider using an N95 mask in this case. Rooms, vehicles, areas used by symptomatic GVPCs. Decontaminate, deep clean, or leave empty for about 5 to 7 days. Designated parking and cleaning area for all vehicles. Biohazard waste bags, if it's soiled or used PPE, etc. Remember, apply measures to this as well. Caution, extreme caution. Staff who had contact, self-isolate for 14 days. All right, so see your flow diagram in the protocol for your staff. When businesses reopens, test all staff for COVID-19, antibodies if possible. Positive staff must be isolated for 10 days. Staff with antibodies, lower risk, possible carers for COVID-19 cases. Symptomatic staff don't enter premises or isolate FFP1 surgical mask plus decontaminate the work area. Self-isolate, test if possible. Regular check-ins from senior COVID-19 persons as well. Positive cases. All members on shift team to isolate 14 days and test if possible. Inform the Department of Health and investigate the business's compliance with protocols. Special areas with regards to your goods and services and your goods receiving and loading bays. Minimize delivery people on premises, all right? Utilize own staff to handle deliveries preferably. And PPE includes shoe protection, gumboots, protective boiler suits, and gowns. Wash your hands frequently between each and every delivery and upload. Sanitize your goods before entering, like I've mentioned earlier, and refrigerators. Sanitize the area or surfaces regularly. Advise vendors of procedure for goods receipt and staff PPE. Laundries. See procedure for the flow diagram in your protocol. Train all laundry staff on the protocol. Sanitize your hands prior to the entry. Required PPE, as mentioned prior, gloves, your mask, your boiler suit, your shoe coverings. Sanitize all surfaces and equipment on start of each day. See procedure for soil linen. All right. Before handling cleaned linen, remove and dispose of PPE. Use the new mask after that, and wash and sanitize your hands. Right. Remember, when you're donning, which is when you're putting on your mask, sanitize your hand. When you're doffing, which is removing your mask, sanitize your hands. Stagger laundry changes to avoid backlogs. Demarcate floor areas, PPE, your dirty zone. Mask, make sure that it's a clean zone. End of shift. Sanitize all surfaces and equipment. Okay, far in to your door. Sanitize mops and cloths bucket at the door. Outsource laundries, letter of guarantee. Okay, and also make sure that you're compliant with SANS 10146. Okay, remember that 10146 specifies the requirement for safe, effective, efficient, and economic management of all laundry processes. Conferences and functions. Likely to remain subject to regulations if permitted. Use extensive WHO guidelines and make sure that you've got a risk assessment, and about 49 possible risk mitigation steps are outlined in that protocol as well. Operate similar to other public areas like restaurants. Revise your floor plans. Ensure there's 50% capacity, 1.5 meter social distance. No cocktail functions. Demarcate spacing, queues for arrival areas, beverage foyer areas. Food and service protocols, look at the section 11 that I've just been through. Sanitize and hygiene, look at sections 9 and 14 that we've just gone through. Okay. Only individual waters and mints as well. Pens, papers on request, no sharing. All right. If somebody has to sign a register, for instance, ask them, hey, do you have a pen? Can you use your own pen? So things like that, apply measures like that. Remaining pens, wipe and dispose of, and paper, make sure that you dispose of paper as well. Gym, spas, shops, and kids' play areas. With regards to your spas, only when regulations allow, okay? We're not allowed to operate yet. Initially, non-contact options may be possible, saunas, steam rooms, etc. All hygiene, sanitizing, spacing protocols apply. Disposable gloves for staff, all equipment sterilized between treatments, spa linens replaced after each treatment and washed, shops, essential items only depending on regulations, all other protocols observed, gyms, close until regulations allow, and consider alternatives, running, walking routes, etc. Kids' play areas, game rooms, closed or open with limited static space. Clean equipment frequently. Theater, nightclubs, child mining facilities, bars, etc. Closed until social distancing measures align to the regulations. Vehicles and special vehicles. Game drive vehicles. Remember, roll bars and handles must be wiped down. These are communal touch areas, high touch areas, okay? Binoculars, try not to share this. Wipe frequently by guests. Portable food and drink containers, disinfect after each use and thoroughly at end of every trip. Ponchos, disposable, or allocate personal ponchos for the duration of stay and industrial clean after every use. Vehicle protocols, refer to section 12, and your food service protocols, refer to section 11 that we went through. Remember, at each and every single section we've been dealing with specifies your social distancing as well as your sanitization measures. Consider onboard toilets should be closed on short trips, and if onboard toilets are open, they should be thoroughly cleaned and surface sanitized every 2 hours. Sanitizers must be provided inside. Other considerations on board toilets: close on short trips. If open, clean and sanitize every 2 hours. Provide sanitizer in vehicles to passengers and staff, and wipe taps and handles after use. Sanitize your hands after the wiping as well. Use megaphone, quiet vox systems to address passengers. Avoid turning and shouting. Enable audible through perspex shields. Clear vehicle entry and exit procedures. GVPCs enter one at a time. Ask not to touch the seats at the back, etc. And replace disposable headrest covers after every trip. Just like how you see it on the airlines, right? They've got those covers at the back. Those are all disposable. Vehicle ventilation, consider aircon, which is your HEPA filters, like I explained, about 99% filtration capacity. And open your windows, all right, to allow for natural dilution ventilation. With regards to tractions, okay, risk level dependent on the nature of the traction, standard protocols apply. GVPCs recording, surface sanitizing, hand personal hygiene, social distancing, queue management, PPE, etc. Protocols can also allow for safe operation, shop and food service protocols where applicable, and online pre-sales by time slot if possible. I've provided a picture of myself going on a holiday in Port Alfred. I'm sure you guys know that big pineapple. I thought it would be a bit fun towards the end to look at. And then activities, risk level depend on the nature of activity. Examples: cycling, hiking in small groups, golfing. Low risk, protocols easy to follow, right? River rafting in large area rafts, activities involving personal safety checks, and more difficult to practice safely. I've also provided a picture of Kenneth here. He often canoes and does rowing and things and activities. Now he's actually in lockdown and he's missing his activities. So remember, the review of activities still needs to be carried out to be established, and risk categories and requirements have to also be acknowledged here. Currently, no activity should take place. Thank you.
Thank you, Nadia and Kenneth. Wow, the amount of work you put into these two presentations for us in the tourism and travel industry, I cannot thank you enough. I know how much effort you've put into it. Really in depth and really appreciate it. Unfortunately, we are over time, so we have received so many amazing questions and some really, really good suggestions as well in terms of templates. I'd like to encourage you all to send through any questions that you have to natalia@bigambitions.co.za. I'm going to pull an FAQ together based on what Kenneth and Nadia have shared with us today, and perhaps also touch base with them just if I'm not able to answer those questions, so that we can release something really robust to all of you who have attended the webinar today. So we're not going to have time to do the Q&A, but I promise, I commit that we will put an FAQ together for you, and we will send it out. Nadia and Kenneth and Apex, thank you so much for all the time that you've put into this today. We really, really, really appreciate it as an industry. I know the protocols are contentious. They're not finalized. The Tourism Business Council is pulling them together. So let's hope that we can be practical. I could see some themes coming out there that could apply universally. So we're going to try and simplify things as much as we can for you guys and send it out. Everyone, stay safe, stay strong. Thank you again to Nadia and Kenneth. I hope it warms up in Durban for you, Kenneth. Kayak again.
Yeah, I don't know where I'm living because Kenneth is freezing. I have nothing else on.
I'm always cold.
You're both in Durban, so there's clearly something going on. And thanks to everyone for logging in and spending their time with us this Friday morning. I will see all of you next week, hopefully on another webinar. And yeah, have a good weekend. Enjoy, guys. Cheers, everyone. Bye.